just tell you something that I've been working on recently. So the question is, what have you been working on recently?
What have you been working on recently?
Well, the answer is, I've actually thought this out. The answer is, I've been looking at what are the philosophical roots of cognitive therapy. And it seemed to me that the philosophical roots of cognitive therapy go back to the Enlightenment. And as you know, the Enlightenment had three features. The first feature was humanism, and the second was reason, and the third is science. And people like Descartes and Rousseau and Kant and so on were firm believers in this. As I thought about it, the humanism is based on the unique personality of each individual, the unique meanings that each individual attaches to what they do. And so part of cognitive therapy is to find out the unique meanings of events that happen. So something that might be very meaningful to me might be meaningless to somebody else. So there's the uniqueness. The second is the reason. And as you know, people are born with a lot of cognitive biases, xenophobic biases, for instance. But in the course of their life, they may or may not learn to de-bias themselves. But cognitive therapy, par excellence, is devoted to de-biasing misinterpretations. So again, as I mentioned before, when somebody seems to have a cognitive distortion, you ask, what is the evidence for that? Are there alternative explanations? Does it logically follow, etc.? And the third is science. And as Judy asked me before, there is a scientific foundation for what we do. But not only that, but we also try to train our patients to be amateur scientists so that they will really look at their own thinking and apply the scientific method to their own thinking, which may or may not come out in the role plays. So that's it.
I didn't know you were working on that.
That's just this
You haven't kept me up to date.
It was just this morning.
Oh, it's just this morning. Wonderful. Well, we did have lunch together.
Right.
Okay. Can see I really have to check in with you hour by hour. Can't imagine what you're going to be working on tomorrow morning.
Well, part of it was I thought somebody might ask, is there anything new?
Yes.
And so I was inspired by the audience. Okay.
That's great.